Hello everyone, my name is Lisa Arnold and I am running for state representative in the 17th Middlesex District. I am a founding member of the Solidarity Lowell organization, which is dedicated to social justice issues. And over the past 4 years, we've heard from so many organizations who are doing great things and trying to pass laws at the State House and not having a lot of luck. So I want to be one more voice at the State House helping to get these initiatives passed, because they will make the lives of all Massachusetts residents so much better. And I'm running because I believe when people work together, we can accomplish great things. This COVID-19 pandemic has really shown us what isn't working with the government. I think some of us knew, but now it's become very obvious. But what is working are the people. There have been so many people who have stepped up to take over where the government has failed us, whether it's using 3D printers to make face shields, or sewing masks at home, or donating food, or driving the food to people who can't get to the stores on their own for various reasons, or the people who helped me when I asked for supplies for the hand washing stations. All of these people have really stepped up where there's a need, and I think it's great. For me, the hand washing stations were something that when the city shut down, I saw that the public buildings were no longer open to people. And while it's a minor inconvenience to the majority of us, for the homeless, it really left a gap, because they no longer had a place to go from when they were asked to leave in the morning from the shelter until they were able to come back. And so I really felt we needed to come up with an answer, especially since the CDC says the number one thing that we can all do to help prevent the spread of this virus is to wash our hands. So for the health and safety of both the homeless population and those of us who do have the ability to wash our hands, I think having a place to wash your hands is a critical need. So I figured out how to make it happen, and then just executed on it and solved the problems of what the issues were with it afterwards. And I think that's really what I want my state representative role to be, is to figure out what people need and solve the problem, and then work on making it permanent after that. Our community is surviving because ordinary people have gone to extraordinary lengths to take care of each other as the system has failed us. But not everyone is doing okay. This pandemic is not just affecting our physical health and daily life, but it's affecting our mental health as well. Whether it's the stress and anxiety from losing your job or getting less money in your paycheck, or maybe you're experiencing loneliness from the isolation that we're being forced to go through, or perhaps you're worried about losing your home or your business, or being evicted because you can't pay the rent. I know what it's like to be going through this anxiety and not having a good support system. Within 3 years, I lost both of my sisters to mental illness, and I saw firsthand how the healthcare system has failed to provide the necessary access and care in a timely manner. The minimum available care is not consistent across insurance providers, and especially when dealing with mental health issues, having consistency of care is very important. If you have to change therapists in the middle of a crisis, perhaps because you were forced to leave your job, or your job decided to just change insurance carriers on you, it can be a life-threatening event for some people. With universal health care, we could assure that no matter what our situation, our medical providers that we trust will be there for us through any crisis, and we won't have to choose between our health, our jobs, and our home. The ugly truth of these housing and health crises have only been more exposed, and after this pandemic is over, we're going to need to rebuild. Small business relief has been made available, but it's not going to the mom and pop stores and restaurants who really need it and who we rely on for our community to thrive. We also have reassurance that there will be no evictions or foreclosures during this time, during the stay-at-home advisory. But what happens when that stay-at-home advisory is over? I know what it's like to live paycheck to paycheck, to have to choose between putting food on the table or gas in your tank so you can get to work, to having to choose between going to the doctor or putting a roof over your head. These are decisions no one should have to make. And in today's economy, even before the pandemic hit, this was a common inner dialogue many people were having. And now, with this, so many of us are one paycheck away from crisis, and we've seen how it's affecting our either ourselves or our family members and friends. So we need to find an equitable solution to the affordable housing crisis. Our tax dollars are being spent inefficiently because it's costs 3 times as much to provide services to people who, after they've lost their homes, than it would cost to keep them in their homes to begin with. We also don't have enough homes. It can take between 8 and 11 years sometimes for a person who has a need for a home to help getting a home. 11 years, 8 years, 11 years, a lot can happen during that time. So we need to have houses available now for when people need them. So first, we need solutions that will help people keep their homes. And second, we need houses that are available at prices affordable to those at all income levels, and especially for those trying to make ends meet with salaries below the median level. I also want to be a champion for public transportation. We need to ensure that trains and buses run where the people need them, and that the cost is within reach to those who need it most. The MBTA is broken more often than it's running, and the costs are increasing while routes and hours are decreasing. So our public transit system must be more efficient, more affordable, more reliable, and more accessible. I'd also like to be a champion for more accessible streets and sidewalks. Having just recovered from a broken hip, I have firsthand experience with what it's like to walk out there on the sidewalks, and they are not safe for people on crutches or in wheelchairs. And it's not much better if you're walking or riding a bike. There are programs that have money available today, and the 17th Middlesex District should get its fair share of the funding available through the Safe Routes to Schools program and the Complete Streets programs. They're both great programs. And we have seen in places like DC, California, and across Europe that having accessible infrastructure can bring more people into city and town centers, where those people will spend money to help boost our local economy. So having better accessibility infrastructure improves the economy. It will also have the added benefit of reducing emissions, which is an important element in fighting climate change. I also plan to take on climate change, and I support the Massachusetts Green New Deal, which puts the burden of payment on industry leaders who have for so long denied the science and fought hard to delay any action. We need to transition away from electric, heating, and transportation systems relying on oil, gas, and coal. And we need to move that reliance towards solar, wind, and other clean and renewable energy systems. State funding is available for green jobs and infrastructure, and we need to ensure that the money is tied to local businesses and not going to out-of-state investors. I am ready to listen to the needs of our community, to hear what your priorities are, and to help take action. I want to make positive changes to help revitalize our economy and our community. I've had 25 years working in the business environment where I help teams manage major transformations to their work. I specialize in helping teams make big changes and get things done. And I'm ready to get things done for the residents of the 17th Middlesex District. Let's win this together.